Welcome to this episode again. In our episode today, we were meant to finish the other two types of blood pressure, which we did not cover in the previous show because of time. I feel there is more urgency in covering a different subject today, though, because of the risks of making wrong decisions that some people are exposed to where sarcoma is concerned. Surgery is one big part of our health system, and it has saved a lot of people's lives. In cases where the diagnosis is wrong and a wrong surgical procedure was performed, the damage is irreversible. I come across such cases in my line of work, and I've seen a lot of wrong diagnoses in cases of sarcoma because sarcoma causes lumping, which is confused with malignant tumors. Our show today, therefore, looks at the complications of sarcoma and the importance of ensuring the accuracy of diagnosis before making a final decision about the recommended surgery, which may be irreversible and may be the one thing that may make or break your health. So enjoy the show.
Have you ever wondered what makes one person have such flabby muscles while the other is so well toned? Ever wondered also what causes such lumps in people's skin, or bone pain and deformity that never responds to any treatment? You may have to look at sarcoma. There are many other causes for such conditions, but sarcoma is top on the list. What is sarcoma? It is a tissue cancer. What is a tissue? Let us take a look at that. The body is made up of billions of different types of cells, which follow a structured program of production right up to death. Cells of a similar type group together and form what we call tissues, which then perform a common function.
Welcome to another episode of the Dr. Alternative Show. My name is Carol, your presenter, and medical intuitive is Tembi. Hi, Tembi.
How's it?
How are you doing?
I'm good.
Good. I'm very well. Looking forward to another jam-packed episode of information for our listeners. Tembi, in the past, we've spoken about sarcoma, one of our episodes. Do you want to remind the viewers again what sarcoma is?
Sarcoma is actually a tissue cancer, Carol. It's cancer, but it's a tissue cancer. It may be soft tissue, it may be fat tissue, it may be gastric tissue. It may even be the dermis. It may be the skin, but not the top part of the skin, but the dermis, which is the layer underneath the epidermis. So it is a tissue cancer.
Okay.
But it concerns me a bit because there is a lot of misdiagnosis of sarcoma. And I'm basing this on the cases that I work with on a daily basis. I get a lot of people with wrong diagnosis. So I think we really to give it another best shot.
Is this the reason for doing it again or bringing it to the viewers' attention again?
Yeah, that is the reason. But the other reason that has made me feel maybe we should look at it again is that people are actually subjected to a lot of risk because of wrong diagnosis of sarcoma. Where you find, particularly in cases where a person has got to decide whether or is advised to go for surgery, for something to be removed or whatever, because they pick up lumping. So I've had a few cases like that where I felt, this decision can make or break this person. And if it breaks this person, it will be for the rest of his or her life.
Sure.
And if it makes her, it will also be for the rest of her life. So it has put me in a very difficult position where I if I leave it and not deal with it the way we're doing, like talk about it, I would regret it for the rest of my life if I don't let people know, just because maybe I fear that conventional might think I'm trampling on their toes. But on the other hand, that is my moral obligation. I feel it is ethical for me to bring people up to speed as far as that is concerned, so that when they make a decision to go for this or for that, or to decide not to, or to do it, they are at least coming from an informed decision. So that is why I've brought it in, because of the recent cases that have concerned me a bit.
Terry, I think, but also just being kind to our viewers and our clients. I think in giving them an alternative to almost sometimes, which sounds like a death sentence, to people that have to have lumps removed. I mean, it's quite a traumatic situation. So all you're actually doing is just allowing them to see it from the perspective that we see it from.
And make an informed decision.
Correct.
Because the decision is still theirs.
Absolutely.
But at least there are people, because remember, Carol, we're coming from a background where we never had other options that can make us look at things differently.
Precisely.
We only receive it from one source.
Right.
And conventional. And if they say this is the case, then that's the verdict. Mm-hmm. Okay. But now we need to let people are for the first time getting a chance to, and remember, when we give information, we make them understand, because this is the feedback. We try as much as possible to simplify it, so that even if a person is not that schooled in medical or health industry, but they can relate to it because it makes sense. So when we give them information, therefore, we're not just talking above their heads. We try to make them understand, so that when you decide, you understand.
Absolutely.
You're not just following blindly just because you're told to go this way. Sure. You want to know, why am I going this way? And you understand, okay, so that when you decide I want to go this way, it is because you are informed.
Sure.
Not because you have no option. You have no choice.
In other words, you're just providing another avenue.
I'm providing another avenue. I'm giving the information. I'm enlightening people in certain areas. And because your health is all you have.
Paramount.
Your health is all you have.
Absolutely. Tembi, you always give us such good examples and clients' stories to relate to people, to understand the conditions that you're going to be describing. Today we are going to be discussing how many cases? 3 cases?
Yeah.
And the first case being?
Okay. Now, like I say, that when I talked about sarcoma, when we covered the show, I tried to make people understand what it is. Mm-hmm. Yeah. Before I even talk about the first case, you see, there is something that sarcoma does. It creates a lot of lumping. It causes lumps. Not necessarily tumors, okay? But lumps, which are sometimes mistaken to be cancerous tumors.
But Timmy, let me just stop you right there. The minute somebody says to you, I've got a lump, automatically
you think cancer.
Absolutely. I think this has been maybe what the conventional has instilled in us. I mean, I know certain people that have gone for partial mastectomies, and it actually hasn't been malignant. So the minute you mention the word lump, I think you're almost signing a death warrant.
Even worse if it's in the breast.
Absolutely. So you're saying this lumping can appear, and it can appear anywhere?
It can appear anywhere where the tissue, and that is how.
So it's not just breast orientated.
It's not just breast oriented. You can have a lump, and you see, gee, I've got a lump, particularly in the arm, and you see it comes. And you'll find in many cases it's not hard. It's kind of softish. Okay. And it comes, and then maybe a month or 2 down the line you see, and the other thing is it's not painful.
Okay.
So you may have it anywhere. You may have it in your breast. You may have it in your arm. You may have it in a leg. You may have it in the neck. You may have because it causes lumping, because it's tissues. Okay. But now, The problem, and that lumping is just lipomas. In most cases, it's lipomas, which are just fat cells,
Okay.
That emerge anyway. Sometimes you find people may have lipomas. You find those people. You've seen those people that have got the what do they call it? This cow.
Like a hunchback?
No, not a hunchback, but
No?
this. Cows, the bulls.
The fat lump.
Yeah.
Absolutely. Where they say the cattle store the fats.
Yeah.
Yes.
So that is a lipoma, but that's a big lipoma.
Okay.
So you may have lipomas in smaller lipomas that appear somewhere, and it may just be a lipoma that you have. But if it's in the breast, then you end up having thoughts that maybe it's maybe it's a tumor.
Yeah.
Okay. Now this, and that is what creates a lot of confusion. There are people, I can vouch, there are people who've removed their breasts
Absolutely.
on the wrong diagnosis because of those lipomas, because of sarcoma. Now this particular case, this is a client of mine in Gauteng. And when I was giving her a diagnosis of sarcoma and explaining to her that it creates lumping, so she must not be alarmed if she picks up a lump somewhere and think that it's the tumor, it's a cancer, it's a malignant tumor, and then she says to me, "Yay, you know what? I had a lump like that in my breast, and I went to the doctor, and they decided they were going to remove the breast because they suspected it was a breast cancer." Okay, and then she said I was booked in for surgery. But then there was a strike that lasted 3 weeks in the hospital, and they could not perform it because there was no additional help to the doctors at the theaters. So then they were going to call me when the things are returned to normality again. So they called me, but then when they sent me for scanning again to prepare now for the surgery, the lump was gone. They tried to find it. It was nowhere. And then they canceled the operation. And she said, well, in a way, she was really very relieved.
I'm sure.
But she didn't know whether to be happy or not. Remember, they say every time you must keep on feeling your breast for lumps so that you can go and have them removed, or even the breast removed before it becomes affects the whole body. So now when you have a lump, and you believe it's cancer, and then you don't feel it anymore, now you're not sure whether to be happy or unhappy because
Absolutely.
you don't know if it's not affecting other areas.
You don't understand.
You don't understand because they say if they remove it, then they're protecting the whole body from being affected by cancer. So now when the lump is no longer there, you don't know if it has already metastasized into another area.
Absolutely.
In your thinking, because you don't understand. Now you worried.
Precisely.
Should you be happy? Should you be worried?
Yeah.
Meanwhile, this lady was actually saved.
I was just going to say probably the best result of the strike so far.
That was the best result of the strike so far. Because it saved that breast from being removed.
Yeah.
Now, Carol, these are not this. I had one other case which maybe I should just touch on. This was a retired nurse from Utney. She was brought in a wheelchair, and she had this excruciating pain. She had a lot of pain. And she said, I had this pain while I was working as a nurse, and they kept trying to examine, and they decided, but they never picked up any malignancy. So but they decided to remove it because the pain
was
just too much. And she said, I actually allowed that for that to happen. But now when I was talking to her, she had not told me that she had removed the breast. She had just come for me to scan, and I picked up the spleen. Her spleen was really bad. Okay, now remember, the spleen is just below the breast.
Correct.
Where the stomach connects to the ribs. Okay. She had a bad spleen. She had to actually have it removed because it was that bad. So, and then when I explained to her what, and then she said to me she actually had a breast removed. I said, did they test you before they remove the breast? She was crying, Carol. She was crying. And you know what made her cry even more was that she went through a lot of pain.
And she still had the pain?
Because of that breast.
Yeah.
She still had the pain. But now when I told her that the spleen was too bad, I could not help her because she had just... Now she was thinking that she has to go through another surgery.
Absolutely.
She cried. She
can
really
imagine.
cried.
But Debbie, can you actually imagine being in this poor woman's shoes, having this intense pain, going through the trauma of having a breast removed, and still to have the same pain after the operation? And to go through all that trauma again to now have the spleen removed. That is so traumatic for anybody to endure.
Yeah. No, but I said, at least the spleen, you can survive without a spleen.
Sure.
At least it was the organ that she could manage to live a normal life without it. So
absolutely.
I said, at least the pain now will be gone. The pain will be gone. So, but what I'm getting at is cases like these, they concern me. So this is one more case that made me feel. Let me talk to people about first establishing facts before they go for these big operations. Because in most cases, or in some cases, let me not say in most, in some cases, it's a wrong diagnosis. Okay, so that is one case that sarcoma causes a lot of lumping. And if you don't know, but one other thing that baffles me is when they do the scan, because my assumption is that before the doctors go for surgery, they perform a number of tests, and from that battery of tests, they should be able to pick up what kind of lump this is. I don't know how they arrive at
the diagnosis.
Yeah, I
really
don't know.
There's an area that we're not too well informed of as using the intuition.
Yeah, I wish I could get one of them to come to our show just to explain to us before they decide to perform a surgery, what test battery?
Sure.
Do you have to go through? Do you have to go through in order to say this is
100% sure?
Yeah,
absolutely.
Than to say, okay, I'm just alleviating or I'm helping this person from having so much pain.
Sure.
Meanwhile, you end up cutting something that is not the cause of pain.
Absolutely. Well, that's so traumatic for any woman. I think especially with the breast cancer. I mean, any lump is a concern, but when it's in the breast area, I think it becomes more of a concern to a woman to be disfigured in a way.
Even lymphoma, Carol, even lymphoma does cause some lumping because the lymph nodes, once they're swollen, they will feel like a lump. Okay. I've had one client having a huge lymph node removed from her bladder. Okay. And who I had told some time back that she's got lymphoma, but I think she never understood what lymphoma really is. So that lump it was not a tumor, it was a swollen lymph node. Okay. But now what I'm getting at is, what I want people to understand is that when you feel something, when you feel a growth, particularly in the breast, because even cystic fibrosis, you find it may cause some lumping, and you might find the fibrosis in the breast. It may cause. So you cannot just by feeling a lump think
exactly cancer. You know what it is.
Yeah, or think it's a malignant tumor. Yeah. Because a swollen lymph node is not a tumor. It's not a malignant tumor. It's not a tumor in any case. It's just the swelling of that node. So you can just decongest that node and that swelling subsides. A sarcoma, you can just, because that's a tissue. It's a tissue. So if that tissue fat tissue has become is a lipoma or whatever, we are in a position to decongest those that swelling, that accumulation, and break down those lipomas because those are fat cells. So we can break down those fat cells. Then that swelling or that lumping that you feel is gone. But if you've taken a decision too hastily without checking from other sources of information that are at your disposal, you might discover too late that you shouldn't have removed that breast. Shouldn't have removed that breast.
And they can't be removed, unfortunately. And still, you're still going to be sitting with a problem.
Oh, yeah. Sarcoma will still be sarcoma.
Absolutely.
Yeah, because if you remove your breast and it is because of the sarcoma, you have not touched the sarcoma. Sarcoma is still doing its own thing. It's still going to create lumps here and there.
So it's going to continue creating lumps.
It's going to continue creating lumps until you deal with it.
Absolutely.
As sarcoma.
Okay.
Until you deal with it as sarcoma.
Maybe our second example.
Okay.
Being?
Our second example was also concerning to me. And like I said, that I've had a few cases of dermafibrosarcoma, which are also very badly misdiagnosed. Okay. Now, dermafibro is still some form of sarcoma, tissue cancer, but then it affects the dermis. Okay, it may be, now remember the dermis is covering the whole body. It's
Absolutely.
still, it's the skin, but it's the
biggest
layer. Exactly. So you may have the dermafibro. I've seen the few cases that I've had dermafibro in the leg. You find a person has got a leg pain, or even going right up to you find a person has got this pain that is excruciating, but with no explanation. Why so much pain? Because it can be dermafibro is very, very painful. It's excruciatingly painful. This particular client, among the others, that made me feel maybe let me single her out. This one, I'm only going to start treating her, but I just did the diagnosis in the past week.
Okay.
And this lady, she was involved in an accident, okay, that affected the spine. But the bones are not affected. It was just the tissue, okay, the connective tissue. And also even like you find that I said people that were involved in a spine accident, but where the bone is not touched, but then the neurotransmitters are affected, and then they end up having autonomic dysreflexia. But in her case, it wasn't. It was just the tissues, particularly the middle center of the tissues. Tissues that could be repaired. But now she had dermafibro. She's got dermafibro on her leg. Okay. And in her case, it's not just affecting the leg, but it's also affecting the intracranial nerve. The intracranial nerves behind the neck. It's affecting that nerve, and it's affecting the 8th avenue of that nerve. So, and these are the symptoms. Okay. Now, if that nerve is affected, it affects the audio processes. So you might find it may make you deaf, you lose your hearing abilities, or it might make you have a serious tinnitus or pressure in your audio canal. So it tampers with your audio processes, okay? When it hits the 8th intracranial nerve, okay? In her case, it actually did that. And the leg, it was not affecting both legs. She had one side leg, even though on the other leg, it was only starting at the toe level. But the one that was really affected was just one leg. So, and I said to her, and she was also in a lot of pain. Like I said, that dermafibro causes a lot of pain. So I said to her, firstly, I asked, do you have issues with your ears? She says, sometimes, she says, I've even been to hospital to have my ears, because she said, even when I'm flying, the pressure, it's like my ears are gonna burst. I've had issues with my ears, even though I don't know. I mean, I could not get an explanation. What's that? And the leg, I say it's one leg, and she says it's one leg that is giving me sleepless nights. And she says, and I say, your belief is that it's because of the accident, hey? And she says, yeah, that's what I was told. And she even said, one doctor, a neurosurgeon, said to her, in order to relieve you of this pain, I've got to sever, those nerves so that to numb.
She won't have the sensation of pain.
She won't have.
It's not sorting out the problem.
It's not. Well, in the belief was that it would
take the pain away.
It would take the pain away. But now remember, the pain has got a function.
Sure, absolutely.
Now, if you don't have the sensation to feel the pain, you can burn to death and you won't even feel that your hand is sitting. If you can't see and you're sitting on something, you might even be injured to death.
Seriously,
and not even be able to see it because pain serves a purpose.
Absolutely.
Okay. So, but she said, gee, I did not have the guts to go for that one. So I said, rather, let me endure the pain. Now imagine, Carol, this was dermafibro that was causing the problem.
Wow.
The spine did have an accident, but that spine was not causing the limb problems. So she could actually get up and walk if the dermafibro was sorted and that connective tissue was repaired and built up,
Yeah.
So what I'm saying is that even in that case, you find that there are people, because I've had quite a few people with dermafibro who didn't know what is causing so much pain. Because sarcoma is not necessary. It depends on where it is hitting. The what tissue.
If it would be painful or not.
With liposarcoma, in most cases, it's not it's painful. It's just the lumping or the discomfort or the whatever. But the actual pain is in dermafibro. Dermafibro causes a lot of pain. But now, if you've got a wrong diagnosis, then like people who
I wanted to come back to the ears. Because we know so many people that have had operations not knowing that dermafibro is causing the deafness and how to fix it. I mean, can you imagine going for an ear operation and still not having it resolved? I mean, can you imagine living with that and also with the deafness? And I mean, we've seen so many, and I know you've helped so many people like this to avoid this situation, but can you imagine living with this?
That's the thing, that you find a person goes for an ear operation because remember the pain you really feel, you're losing your hearing. It's not like the symptom is not there, it's there. And maybe it keeps on deteriorating because the bigger the area that is covered by the dermafibro, as it progresses, the more affected you will be in whatever area you're affected. So which means, therefore, you are concerned, you don't want to lose your hearing.
Absolutely.
And they've got to find what is causing you to have this problem. So then they're going to do whatever they need.
Absolutely.
But then you come back, you still have the problem.
Tell me, would they still have the pain like an earache? Because we all had earache in one stage or another in our lives. And it's as bad as toothache. I mean, it's absolutely excruciating. Would they experience this?
No, but you see, with the eighth cranial nerve avenue, in most cases, it causes deafness rather than pain.
Oh, wow.
Yeah. In most cases, it causes deafness.
So they wouldn't even have the pain situation to try and sort it out. It would just be...
It's just deteriorating
of the hearing.
It causes more that than... even though in some cases it will. Like I was making an example of this lady that she would feel, particularly if she's flying where the pressure, is escalating. So in most cases, it causes deafness. So people, even though I've seen a lot of people that are experiencing problems of hearing, not because of dermafibro. Like temporal lobes, they do affect that. Superficial siderosis, it does affect the hearing. So there are other problems that causes that, the ear lymphoma and all that. So this dermafibro, when it hits that nerve, and you might find we could probably go to the Deaf Society and find a lot of people that should not be sitting with a hearing aid because the causes dermafibro and dermafibro that can actually be treated.
And tell me, is this across the board in age groups, from babies to adults?
Well, even though you'll find that they will say it starts at a certain age, but I've decided to move away from that.
Okay.
The reason why I'm not just referring to dermafibro, I'm referring to all illnesses.
Okay.
The reason why I'm saying this, because when you read the literature, you'll find they will say this particular illness is more prevalent in this age group or among blacks or men or what. But what I've found when I'm doing my own work is it just negates.
Okay.
It negates that you can't have this particular illness if you're at this age or hanana.
Okay.
But I would say maybe it might not be too prevalent in the young age. Why am I thinking that? Because firstly, what I've discovered in my own work is that sarcoma is linked to aldolase A deficiency.
Yes, that's where I was coming to.
Yeah. Sarcoma, there is not one single case that I've dealt with that has got sarcoma that does not have aldolase A deficiency. That I have with a degree of certainty.
Yes.
Okay. Now, if you're therefore deficient on aldolase A, aldolase A is not the type of deficiency that causes havoc if you're not touching fructose. So when you're still young, if you have not touched fructose, even if you are a candidate for dermafibro, you'll probably find it may only start hitting you at a later stage. Just like retinitis pigmentosa.
Same.
I want to do a show on that. The reason why I want to do that show is I have seen children and I've seen younger people who are not even aware that they are candidates for blindness, total blindness when they reach a certain age, but who I can pick up have got RP already, and it concerns me because RP is a nasty one.
Absolutely,
it's really nasty in terms of messing up the sight of people. So like with dermafibro, therefore, you'll find that if a person is deficient on aldolase A enzyme, is a candidate for any form of tissue problems. It may be lupus, doesn't have to be dermafibro. It may be any form of tissue problems. But dermafibro is in the list of tissue conditions.
And together with deafness.
Together with deafness.
I was actually bringing up, when I said I knew you were going with the fructose again, was the amount of babies that I see getting grommets in their ears. And I know with babies we're feeding the little pureed fruits and the fruit juices and these kind of things. And I see it only happening when we're starting to introduce food into their diets. And when you said about the aldolase A, I knew exactly where you were going with this because we see so much of it in young children with the grommets and the tonsillitis. Absolutely all starting all over again. It just brings another whole perspective to the situation of aldolase A again. Tembi, that was amazing. Our third case is going to be what?
Our third case is a uterine problem, which was not a uterine problem in my case.
Okay.
In fact, before I even talk about this lady, I had a client once, I think about 2 years ago. And she came to me, she had been referred by a friend because she was due to go and take an operation, a hysterectomy, to remove the womb. And the friend, and she was in so much pain. She was in so much pain. And she didn't have children. She had accepted that she can never have children, but she cannot live with this kind of pain in her uterus. So, and the friend referred it to me, so she came with her husband. And a nice, classy looking lady, But she had fibroids. She had fibroids. She was really infested by fibroids. And, but besides the fibroids, it was not the fibroids that had made the uterus to be in such a state. She had uterine lymphoma. Okay, so the lymphoma lumps, nodes were also adding so such that I think maybe when they checked the ultrasound, they saw a lot of bulgy, of all those lumps, and but the fibroids had not covered. She did have fibroids, but they had not covered the uterus. But she did have uterine lymphoma, and she was in a lot of pain. So when she came with her husband, she said to me, if you can just help me get rid of the pain. I don't want to go for this hysterectomy, but my husband is supporting me because he's watching what I go through almost throughout the month. I said to her, not only will I be able to relieve you of this pain, but I'll get you to fall pregnant also.
Wow.
And she looked at her husband. I could see it's like,
the disbelief.
Yeah. I mean, okay, it's a selling
But we actually can't blame her to think what she had been through. And I'm sure she's been to many.
Yeah.
And you were just another one saying, well, I can help you.
I mean, seriously, I could see, she thinks, oh, here she goes again, selling peach,
Sure.
I said, I don't have to make you believe that I can make you fall pregnant. But I will be able, you mustn't go through with
the hysterectomy.
This hysterectomy. Don't. She said, I trust you because this friend who has referred me to you, you've helped her quite a lot. She was from Amtata. So then I started working on her Carol, and she did not have enough money to cover for the second program, but I started with the first. And the other thing, she was bleeding nonstop. That was the other thing that was frustrating her.
I can imagine.
Yeah, and she was she was bleeding profusely with clots, heavy clots. So that's why they really believe that you better get rid of this because it might even be cancerous already. Of course, remember, lymphoma is cancer.
Sure.
But it's not the aggressive form,
Right.
So then I gave her the treatment, the first program, and she said the bleeding stopped like immediately. The pain did not stop immediately, but it subsided.
Sure.
Subsided, but then eventually it stopped. And then I said, you've got to take the second program. Well, she didn't have, I remember she sent her pastor to come and collect the medicine because she did not have enough. And the pastor, they could only take some. And then she went on the program. And then I forgot about her because she didn't communicate with me afterwards. And then this particular day, I get a report from the consultant. She says, you're not going to believe who called me. And then she mentioned it's this lady. I said, yeah. She said she was so excited. Why? Not because the pain and the menstrual pain and the bleeding had stopped, because that stopped a long time ago. She discovered that she had fallen pregnant.
Oh my word.
But she discovered when she miscarried.
Oh no.
That she had fallen pregnant. When she stopped the bleeding, she thought it was still the medication that was now regulating her hormonal system and all that. She didn't know that she had actually conceived.
Oh my word, shame.
Until then she started having this heavy bleeding and she had this pain. Then she thought, no man, this feels differently from what I know. This is like cutting me now. And then she went, and meanwhile she was miscarrying. Oh. So it was the cramping from the
labor pains.
Yeah, it was the labor pain.
Yeah.
But she was excited because she discovered
she actually could.
That she can actually fall pregnant. I really, some of these cases,
yes, absolutely.
She said the fact that I can actually fall pregnant, even though I've lost the baby, just the realization.
Just knowing that she actually can still have a child.
That
after being told hysterectomy.
She was supposed to remove her womb.
Absolutely.
So that lady, it's just that we've got lots of clients for us to remember to go back and check how, if she felt pregnant afterwards and all that. But this is a case that came also. It's an old client it's not an old, but it's a few months client of mine who came also with the same problem of excruciating abdominal pain. And she had been told that she's got fibroids. I examined her, and even though there was a problem with the fibroids, it was not a big issue because the fibroid was actually, and I told her from the word go that the problem that I see is not from your uterus, but from your bladder. She had bladder lymphoma also. I said, I can pick up and your bladder is even enlarged. It's not even its normal size anymore. So, and I'm going to treat you for bladder lymphoma, not for, she was also having a problem of bleeding. Okay. And this is where you find the confusion is huge. Because now can you see, she is bleeding and she's got excruciating pain in her abdominal in her abdominal
area.
So obviously it stands without reason that it must be the uterus.
Absolutely.
Okay.
That's what you would think automatically.
Of course.
Yeah.
So now when I come with this diagnosis of mine that, no, the uterus needs a little bit of help and to sort out the hormonal balance. And also I tell her the reason why you are having a hormonal imbalance, you must remember firstly that the organ that produces sex hormones is the liver.
Again.
It's the liver.
To me, the liver is still the important part of the body, Tembi.
Yeah,
as far as organs, absolutely.
I said that liver regulates hormonal system because the sex hormones belong there.
Yeah.
So when it is in trouble, therefore, one of the disorders will be the hormonal imbalance. That is why you find when people go for they're going to menstruate and all that, you find that the skin changes and all that, they get irritable because that liver is big there. And you know when people have got liver issues, they get very irritable.
Yes.
Okay. So I say the menstruation is because of the liver. It's got nothing to do with what I see in the abdominal area. Okay. And you are, and fructose intolerant again. I tell her, stay away from this and this and this. Of course, she was gluten and lactose and all that. I told her the diet, and I gave her the treatment. And 2 weeks after that, the report in her file, the improvement, lots of improvement. And now this is the other symptom that she had, which was a problem. She had urinating was very painful for her. And I said, that is a confirmation that the problem comes from the bladder. Okay, because the uterus is not a portal for urine. Your bladder is the portal for urine. So that's why you feel such a burning urine. It's because it's coming from the bladder. It's just validating my diagnosis.
Exactly.
Okay. So then I treated her. And then that was the report that the peeing is not a painful thing anymore. She feels a lot of improvement. And she said she still feel a little bit of lumping in her abdominal area, but the pain was not there. Okay. I said, okay, we've got to continue with, because lymphoma causes nodes, they tend to swell. Okay. So I continued with the treatment and that was fine. Now she comes a few days back. She comes from her gynecology, and her gynecologist said the fibroids, she's got a lot of them, and they've expanded, they've spread, so she must go and remove the uterus. And then he asks if she's got children. She says no, and then he said, well, then maybe in that case, because you don't have children, maybe you can just remove the fibroids. But she said the fibroids are all over. So she comes to me, she's dejected and frustrated and all that. And then I say, okay, let me scan you first. I don't work on other people's diagnosis.
No.
Okay, so I scan her. The first thing that I ask is, before I give her the report, I say, how are you doing with your diet? She says, well, I try. I said, no, just tell me the truth. How are you doing with your diet? Do you eat fruit? She says, I eat a lot of fruit.
Mm-hmm. And she's fructose intolerant.
She's fructose intolerant. She says, I eat a lot of fruit. And I say, meat? She says, I eat a lot of red meat. I love, she says,
she craves it.
She says, I eat, she says, I must be honest. And she says, it's difficult to get these foods that you suggested, and bread and work. And then I don't use white bread, I use brown bread. I say, you have not even tried well, you have, but you failed.
Dismally.
And your problem comes from that. That I told you then, and I can tell now, because even if you had said to me you're sticking to your diet, your results are telling me the opposite.
Yeah.
Now the problem now was still in the bladder, Carol.
Yeah.
But now it was not just the bladder, it was gastric also.
Oh my word.
She had the lymphoma, the lymphatic system had stabilized, really stabilized. But now she in fact, she did not just have, it was the bladder, it was the gastric, and it was the esophagus. And I said, do you feel anything? She says, I feel like my esophagus is squashed in because of the lumping. She says, I really feel like that. It's like something is pushing it close like this. And the gastric, she had lumps in the gastric area, in her stomach, and she had the one in the bladder, not in the uterus. The one in the bladder was even like a big lump that had not touched. It was like two lumps, but that were connected at the bottom. But in the upper part was still open like this. So it was just a matter of time for it to join in. But it was still two lumps, but joined at the bottom like that. And I told her, and she said, the doctor says, my gynecologist says it's huge. And it was. It was huge. I said, it's not even one lump, it's two lumps. And you do have smaller ones in your gastric area. The smaller ones are in your stomach. But this big one is in your bladder, not in the uterus. So you would have removed the uterus, or they would have opened you and see that and pick up, because even if when they open you and they open the uterus, they're not going to find
absolutely
a thing in the uterus. Then they realize, where is this? It's in the bladder.
Absolutely.
It's a different organ altogether.
So you mean they would have just sewed her up again?
I hope they would have. I really hope. But I've had clients that work in the theater.
Yeah.
Who would actually tell me that, man, what we see there, what we see there, that people get open and then close the game. She says, some you find that that particular area that needs surgery is frozen. The tissue is frozen, is with, such that they have to close you without, and you probably won't even know, because if you come from an operation and they're treating you and all that, they're not going to tell you anything. You've been to a surgery, so what they've removed or whatever, if they don't tell you, you don't know if you're supposed to be told anything except that, this was okay. This went okay. In most cases, people don't get a feedback.
Well, you don't think you would really ask, actually, if you think about it. If you're going for a bladder op, you don't ask them what he took out and what he didn't take
because
out.
they've taken something
Whatever
out.
was necessary. Sure.
The only thing that would concern you is to still feel something is still there.
Absolutely.
Then you would wonder what happened.
Yeah.
Okay. So I said to her, therefore, it's your call. I said, it's your call. If you go for this operation, trust me, Carol, operations are necessary.
Sure. They have their place.
They have a big place.
Yeah.
There are a lot of lives that have been saved because of this. But
absolutely,
it must be the correct operation for the correct diagnosis.
Yeah.
So that is what I'm saying to people, that before you take that decision, because imagine, this is a young girl. She has never had children before. And now imagine if they were going to tamper with that uterus. What are the chances of that womb being in a position to carry a child?
Tembi, having listened to all of that, I can just imagine what must be going on in people's minds. They go and see a physician, a doctor, a surgeon, and he shows them a growth, and they can actually see it. And he tells you it's a tumor. I mean, you must be frightened out of your mind. What options do these people have? What are their options when there is a company like Health Haven and a lady called Tembi who's our intuitive? What are their options?
Yeah. Firstly, when they say you need to identify something and tell them in good time, because then that gives you a chance of saving or containing that. That's true.
Yeah.
That's true. But also equally important is you've got to know is that the correct diagnosis? Because seriously, when they show you, I had a case, I come across all these cases where you find a person says, no, he shot me, and I actually saw it. Now, before I answer the question, my question, which I would have loved to ask from the doctors. Now, if you have a scan, let's say you're doing the brain scan, and you see a growth. How do you know if it is a clot, or if it is a cancerous tumor, or it is a hemangioma,
Absolutely.
or it is a lymphoma? How do you know? That is what I would like to know first of all. Because you find cases where a person says, no, I saw something. And in most cases, when he sees something, it's not like they're lying when they say there's something there.
Sure, they do see something.
Exactly. Mm-hmm. Just like it was the case with this lady. There was a lump.
Exactly.
It's not like they created stories to say, oh, there's a lump, but it's not there. But the difference that I'm coming with is, if it is, you've got to know what growth that is.
Sure.
Because that determines what course of action to follow. If it is a lump, mm-hmm. that is not malignant. It's a lipoma. Lipoma, you can decongest that fat,
sure.
and then the lump is gone.
Yeah.
If it's a clot, it's a blood clot. You can do that. Mm-hmm. If it is a hemangioma, if it's because it happens in the brain and in the vessels, you can also work on that. So what I'm saying is, you need to decipher.
Absolutely.
And know. You can't just say because you see there is a growth and then you say, hey, let's go for it. Let's go cut. Mm. So that's the first thing, that I am not disputing the fact that when they see it there, it is there.
Sure.
But all I'm saying is, what it is,
sure,
is very important to know what it is. Because you may perform a surgery that should not have been performed, mm-hmm. or you may not perform a surgery which should have, exactly.
Correct.
So that is the starting point. Mm-hmm. And I don't know if conventional medicine can answer me on that, because that is where I would like them to answer me. Can they tell when they see a growth what kind it is? And
also some of the cases that have come to us where they've been for all the necessary tests and probes and scans and biopsies, and still.
Yeah. So I'm not thumb-sucking it, Carol.
Sure,
I'm not thumb-sucking it at all. I would love to sit with conventional like this, and discuss these issues. Yeah. Like, are you in a position to tell what it is when it's sitting? Because sometimes you find they say it is in a very sensitive spot in the brain, so they cannot. It's inoperable.
Sorry, just on that point, Tembi, you're hitting something now. If it is inoperable, is it possible to take a biopsy?
I don't know.
If it's inoperable, just the mere fact of an incision or a probe, would it be possible?
I don't know. I don't know what is and not in their case.
You're bringing up a lot of very interesting issues here, which we would like to have resolved if we were allowed the opportunity.
Exactly. Yeah. So the options that they have, therefore, is, firstly, when they say there's a tumor, you need to find out what tumor is that. Okay? Because you'll find that they will say there's a tumor, but it's not growing. Or they say it's growing. What kind? What kind? So you need to find out what growth is that. People have got a right to ask,
absolutely,
and understand, and be satisfied with the question. So that's the option they have. That's the first one. Secondly, you have the right to find out from other practitioners. You may go to another. Now, remember, this one of finding opinions from other practitioners has always been there, but you find that they go from one conventional to another. But now, for the first time in the field of health, there is alternative. That's not that it has never been there. Like I've said, there are alternative practitioners who have got such gifts, it would blow your mind. But who have never had a chance to come out in the open.
To exercise those
because
abilities.
They're too scared of being trampled on by a conventional.
Yeah.
I mean, so, but here we are, okay? First time we're saying, we will be, you don't even need to tell us. There's nothing that I want to stress more, that you come, there's something in your brain, or they've told you, come here and come with a clean paper and say, tell me what's going on.
Tembi, I've seen most of the files, and where you're asking, or where the intake form would say, what problems have you experienced, high blood pressure, cholesterol, they just put a line through everything.
Exactly.
And nothing is told to you beforehand.
Nothing is told me. And I am happy when they do that.
Absolutely. I think also it's nice for them to actually hear it firsthand from where they've given no prompts, no clues whatsoever. They sit mum and then are shocked with their diagnosis to the accuracy that you deliver.
And when we say you have got something in the brain, we will say what it is.
Sure.
We will not just say we see something somewhere. We will say what it is. We will say what it is.
Specific.
We are so specific. We tell you where it is and what it is and what causes it.
And how we can fix it.
And if we can fix it, we will also tell you. If you must go for surgery, we will also tell you. I mean, there are cases where I refer, say, I cannot touch you. You must go either to a cardiologist or to a neurologist or whatever. So it doesn't mean we like I say, there is a big place for conventional medicine.
Absolutely. To work in conjunction would be the ultimate.
That would be the ultimate. So that's the option that people have. But don't go and have your organ removed without checking.
Absolutely.
With health haven. You don't have to buy medicines or whatever, but just so you can have
peace of mind.
Yeah, so you can have peace of mind.
I think also, especially when it comes to with children, that you actually can allow the child to have the best of what is available. So, what we always seem to be such heroes when it comes to ourselves. No, we're fine. We'll just do this. But when it comes to making decisions for other people, your elderly and your children, I think it's always nice to know that you've explored every available possible option to get the best that we need. And as you so rightly said, to work sometimes in conjunction with conventional is what is required.
We need them. They need us.
Absolutely.
It doesn't matter if they pretend they don't. They do. We need them too. We don't pretend we don't need them.
Absolutely.
But we're very vocal about that.
It forms a very important part of what we do.
A very important part of the health.
Timmy, would you say this is the advice that you're giving to our clients?
That is the advice I'm giving to our clients, that if you have got a lump or a swelling or that is collected in one spot and they tell you must go for an operation, before you do, just come and get what we find out what we ourselves see.
Second
and then
opinion.
Decide after that.
Absolutely. Allow yourself the privilege of a second opinion, which could be a life-changing decision in actually retaining a breast or an organ that is vital to our existence and to our whole being as a person, as being a whole person. Tembi, thank you so much for a great show.
You're welcome.
Thank you.
Health Haven is taking the health industry by storm. They are the talk of the town. They have the gift of healing.
One of the main objectives of this show is to inform and educate people in the field of health, and to do that from an alternative perspective. Our assigned task by the universe at Health Haven is to provide information and alternative assistance to you, and your task is to use your God-given right to choose. But this time, you will choose from an informed position. Thanks for watching, and God bless you all.